And set the recording. Here we go. All right, so I'm Dr. Carrie Jacobson. I'm with the Optimal Holistic Health Center, and tonight's topic is holistic medicine and really what it is that we do at the Optimal Holistic Health Center that is in Skokie. I almost said Glenview because we were there for 11 years. Skokie, Illinois, is that we really support people using what we refer to as the triad of health: structural, biochemical, and emotional. And so with that, we are, I'm just admitting, we are and have created a space as like a one-stop shop. So we now have massage therapy. We have a holistic esthetician who does facials and waxing. We have a foot detox lady. We have ozone therapy. I have a nurse practitioner who's doing peptides and PRP and IV nutrition and anything, IV chelation, pretty incredible stuff. And we have a Chinese medicine doctor, Dr. JR, who actually does health classes once a month as well at the end of the month. So really, we constantly will do different topics that are very specific to, hormones or thyroid or whatever. But what we've generally always done, especially when we were able to go in person, which we were hoping to do this month, and obviously we decided to kind of backpedal just with everything going on right now. But that kind of has inspired me to this talk as well. So I'm gonna kind of go a little bit into the biochemical aspect and really how you might be able to support your body post experiencing COVID, or as a preventative, how you might be able to support your body there as well. So really our whole thing is helping people to understand and educating people to really understand how the complexity of our body works. And when you can understand it a little bit better, then you're able to better care for yourself, and you don't have to count on people to constantly be helping you or working with you or whatever. What I do want to invite is, I can see on Instagram and I can see on the Zoom. So for those of you that have joined me on Zoom, I'd love to see your faces so that you can sort of participate and interact with me. And I'd love for you to ask any questions that come up, because if this can be a little bit more interactive and I can answer while you've got me live, I can answer questions that you may have as I'm going through, then I would love to be able to do that. So yeah, so definitely let me know if you have questions. So the gist of it is that both myself and Dr. Abby are applied kinesiologists, and applied kinesiologists look at what we refer to as the triad of health, which is what I had started saying. The triad of health looks at the body structurally, where we're looking to, adjust. We want to make sure that the nervous system is intact and happy and healthy, using all different kinds of techniques. So I use quantum neurology. I use something called Neuralink. We use total body modification, which looks at the physiology of the body. And of course, we do adjust, and adjusting opens up the spine. It opens up areas that are locked up so that the nervous system can communicate brain to body and body to brain. So with that, I would say you don't have to wait until you can barely walk, or you have low back pain, or you have headaches, but a lot of us do. I had someone come in the other day and she's like, I always wait till I'm a train wreck to come in. And at least she knows it and admits it. And we tend to do that. We busy our lives so hard, and until we're like running to the ground, we don't come for help. The idea of chiropractic is that it's preventative medicine. And so ideally, you're coming in once a month, or you're coming in once every couple of weeks, maybe once a week if things are pretty acute, so that you can get proper support, start rebuilding and re-educating the nervous system, and so that you can actually help boost the immune system. Actually, every adjustment can boost the immune system by 30%, believe it or not. So there's something to being able to actually feel amazing in your body, no matter what your age. And a lot of us really think that we feel so bad because we're aging. And it's just because we're aging, we use it as an excuse. And what I would say is that's actually not true. You can actually feel amazing and even more amazing in your 40s, 50s, 60s, and 70s than you did even sometimes in your 20s. And it just depends on, the fuel that you put in and how you care for yourself. So what I mean by fuel that you put in is the other aspect of the triad, which is the biochemical side. So that's what, the air that we breathe, the liquid that we drink, if you will. Do we drink enough water? Are we only drinking soda or alcohol or coffee and caffeinated, buzzy drinks? What fuel are we putting into our body? What are we drinking, breathing, touching, eating, injecting even, because all of it impacts our health. And it's important to just be aware. We're constantly reading labels on everything. So be aware of what it is that you're surrounding yourself with. What is the air quality in your home, in your car? That matters. Control what you can control. There's so many places that you cannot control. You just can't. But there's so many places that you can just do your best. And so that would be, the water, a water filtration system, perhaps for your house, or at least the water that you're drinking and the water that you're cooking with, or that you're rinsing food with, the water that you're bathing in and showering in. They make shower heads that can clean up the water. So it's important that you're looking at the biochemical aspects and the biochemical side of what you're doing, what you're putting into your body. Generally speaking, when we're talking about the biochemical side, we're talking about avoiding what we refer to as the 5 pillars of death. That is wheat and gluten, sugar, refined sugar, corn, soy, and dairy. Why do you need, and why would it be beneficial for your health to actually to do that? And the reason is that all of those foods tend to weaken the immune system. So wheat and corn are very highly sprayed with glyphosate, or most commonly known as Roundup. And I think our body just doesn't have the ability to break down and process as fast as sort of science, or the chemicals, if you will, are placed. Our body doesn't know how to get rid of it fast enough, and it overloads the liver. And when the liver is overloaded, which the liver has so many important jobs, like balancing blood sugar, helping with cholesterol, the good and the bad, to digest it out. It helps us to detoxify our body. And so if our liver is overloaded so that it's not functioning as efficiently as we desire it to, so that we can function at our best, a lot of things begin to back up. And when our gut starts to back up, our liver then backs up yet again. So it's just important to be aware of what some of those things can do. And you can control that. Most of the time, you can control not eating those foods and just choosing more whole food type things. So that's wheat and corn. Dairy is mucus producing. It's inflammatory in nature. So is cane sugar, refined sugar, also highly sprayed. Actually, interestingly enough, one of the most highly sprayed crops is tea. So when you're doing tea, it's really important that you either create your own teas or you buy organic tea, just to get a head start, because tea is actually stuff that makes tea is highly sprayed with herbicides and pesticides and things like that. So that's important to know, because again, those chemicals, they override our system and they can really mess with things. So we just want to be aware of that. It can wreak havoc in our system and create chaos. So we don't need extra mucus, especially right now. We don't need to be puffier, cow's milk, our enzymes just don't break down cow's milk very well, but also the way that, especially in America, that they handle cows and cow's milk, they're highly pumped with hormones. There's like bloody, pussy, all kinds of yucky stuff that's found in dairy. You just in general are going to be better off staying away from it. And if you have to choose a dairy or a cheese to eat, I would say our enzymes or our digestive enzymes can break down goat with a little bit more efficiency. So maybe a hard goat or, a soft goat cheese is going to be a better choice if you had to choose. And then lastly, soy, which I'm talking about unfermented soy, and unfermented soy is really what you're finding in soy milk and tofu and things like that. And it's estrogenic in nature and it impacts our thyroid negatively. So that's obviously not great. And it's important to, again, just to have the awareness. I always tell people 80-20 rule. If overall you're feeling pretty great in your health and everything's pretty awesome, then you don't need to sweat it. I would say 80-20 rule. If you're highly symptomatic, you've not been well for a long time, then you need to go pretty extreme and swing the pendulum to the other side before you find what your balance point is. Because sometimes we just don't know. We've been so off balance, we don't even realize how it's impacting us. And what I mean by that too is that one serving of gluten can actually create an inflammatory antibody response systemically in your body that creates a systemic inflammation that can literally last upwards of 12 weeks, one serving of gluten. And it just depends. That's going to be someone that is more allergic to it is going to have that. Someone with sensitivity or just intolerance. And I would argue that most of us have sensitivities to it that we don't always notice. It's not like a 1 + 1 = 2. I ate this, and so then I feel like this. It's going to be a little bit more like I've eaten it a handful of times and now, oh, gee, I feel a little sluggish. I'm a little foggy brained. I'm more congested in my sinuses than I've been. I can't fit into my clothes very well. My stomach is so bloated. But a lot of times we don't notice that until several weeks of eating that way. That's going to be a little bit more of like a sensitivity or an intolerance. And again, so then what do we eat? What do we do then with that? What we do is we focus on eating whole foods. We focus on eating proteins, veggies, fruits, good fats like olives, coconut, avocados. Actually, good fats are so underrated and they feed and fuel our brain. They're really important. Eating good fats like that, including like an egg, if you do have eggs, like making sure that the yolk isn't fully cooked so that you can actually gain the full nourishment. Eggs do not cause high cholesterol. Sugar does. Okay. Eating breads and pastas and pies and cookies and cakes and things like that. That's going to do it. Again, I just want to speak out to those of you on Zoom. I want it to be as if I'm teaching a live class to you. And actually part of the benefit, everybody, of registering as a student for our class, for our free classes, is that if you're a new patient, we actually offer a huge discount on your new patient experience with the doctors, because this portion of education is so important. And it gives you sort of like a leading edge. It gives you the benefit, and it saves us time from having to go through it all with you. You get to actually learn straight up, what we do and who we are. And so we really, truly put a huge amount of emphasis on educating first before treating. So it's a huge benefit to register and come to our live class. I'd love to be able to see your faces because none of you are showing me your videos. So please turn your videos on, and also let me know if any of you have any questions. So for those of you that are on live, and if you catch this after the live, hi, yay. If you catch this after the live, then, jot some questions and we always do our best to answer any of those questions. So feel free to give a shout out if you do have any questions as I'm talking. And I tend to talk a little kind of fast. I get like so into this. I've been doing this for so long. So there might be something that catches your interest and I went by it too quickly. So please just pause me and I'm happy to just to honor your time. You know, you took time out of your busy schedule tonight to be present here tonight. So I want to make sure that I honor your time back and can just be really present with you and answer whatever questions you have. So feel free to let me know. Okay. Yeah, I love to see your faces. Hi. So, with regards to fuel and the biochemical side of it is water. I touched on that briefly. I just want to let you know that a Brita or your fridge filtration system, it doesn't cut it. Okay. It only takes out like a little bit of chlorine, maybe all the chlorine, but there's fluoride, which is a neurotoxin that is found in water. There are critters, parasites, there's pharmaceutical drugs. They haven't figured out how to filter out of your water. It's like pretty gross. So getting like a system like the Berkey, Berkey, the Berkey's a great filtration system. We in our office have Nikken, Nikken. It's a Japanese company. It's a multi-level marketing company. So I've sort of steered away from it a little bit, but honestly, I have a patient who helps out all my patients get the wholesale pricing, and you can get hooked up with it. I think some of their products are amazing, and they actually have a shower head as well. And then Zero Water is really great too. And it's very inexpensive. I have my college kids get that because it looks like they have some that look like a Brita pitcher, and you can use it that. And then in our office, we have like kind of a bigger thing, but even for that big glass thing, and I paid separately for a stainless steel because they gave you kind of a chintzy thing with it. It's like a spout. But it was like maybe 70 or 80 bucks. So it doesn't have to cost a lot of money. And then probably in our office, once a month, we're changing it out. So you notice right away, the water starts tasting really wacky weird. But like, you know, so for maybe 15, 20 bucks at most, I think that's what the filter is for Zero Water. Once every 4 to 5 weeks, you're changing it out. So it's very affordable, and certainly more affordable than buying a bunch of bottled water, which would be what it would take to actually get your body healthy. Why is water so important? It makes up 70 to 90% of your body. Your brain is 90% water. So if you don't give good quality water to your body, like how can you possibly function optimally? And the answer is you can't. You literally just can't. There's a book called Your Body's Many Cries for Water. You're not sick, you're just thirsty. And the guy talks about his name is really long and I couldn't pronounce it if I tried. It's an Indian name, but it's a phenomenal book. And he basically says like headaches, foggy brain, like allergies, so many different things are caused by dehydration that if you just drink water, like if you do nothing else, if you never come to see any of the doctors at our office, if you did nothing else but drink good quality water and with frequency, your life would literally be better. Your health would absolutely shift and be better. It just would. So I just think that's really, really important. And it's under talked about, I guess. You know, like people don't talk about it quite as much. There's lots of talk about supplementation and people get really hyped about that. I will cover some of that. I kind of got a hit before I got on tonight that I really wanted to cover some things that could be supportive for the body, especially right now with everyone's, you know, the buzzwords of Omicron and, you know, and from my research, it can spread, you know, with each person that gets it, it can spread to 7 to 10 people, which is outrageously virulent, but it's way less pathogenic than Alpha, certainly, than Delta, way, way less. And you're finding that people are getting sick, but it's just not so bad. It's not as bad as it once was, although the Delta variant's pretty high still in America. So we just have to be mindful and, you know, we need to make sure that our body, listen, we're not going to escape a microbe. Okay. They're everywhere. Bacteria, viruses, they live everywhere. Okay. COVID is airborne. It lives all over the place. We're constantly passing it. What is the difference between someone that's getting the cold, that's getting a flu, and when you're not? The difference is the capacity of where your body was when you got exposed. So we want to get our body to the greatest state of health that we possibly can prior to any kind of exposure of anything. It just helps us to be more in the thriving. And then it helps too to understand tools and that there are treatments, that there are things that we can do for ourselves to really help us. And that can take us out of a fear-based place. And when we're out of a fear-based place and we can move more from a place of love, we're at a much higher vibrational state. I got COVID at the beginning of October. It was really intense. I was so grateful for all the tools that I had. And in the process of getting through that and getting through like a long COVID experience, because I think that the residue and the spike percent, I'm just getting off hand for here for a minute, but I think it's important. I think that it stays in your body, the residue, for months and months, potentially over a year for some. Okay. But in the process of understanding that and knowing it, and actually getting support and help from my colleagues, I have awakened to a lot of different opportunities and skills, basically, that can support people out of that long COVID experience and can really help people get back into their health. It's huge. And I feel like my life got saved. And as a result of that, I can't help but to pay it forward, which also means lately I'm running like an hour late with my patient schedule. But because once Pandora's box is open, we got to go there. We just got to do it and really help people back to their health. But the biggest thing is, getting the nervous system back online. I think it crosses the blood-brain barrier. I think it messes with brain. You've heard about all the brain fog and the fatigue that comes along with it. I know I experienced that. It was really intense. And when I got tested with quantum neurology, 8 of my 12 cranial nerves were not firing right. They weren't firing at all. And when you add on stressors along with that, it resets your whole body. Listen, everybody, our bodies are absolutely dynamic and amazing. And the ability for our body to heal is profound. Okay. If we are given the right thing at the right time, magnificent things happen. Magic happens. Okay. Nothing is impossible. The only thing we can count on is change. Yay. Thank God. So in the process of that, we get to know that what we're experiencing now doesn't have to be forever, especially if it's not good. And if it is good, keep doing the things that are making you feel amazing and good so that you can sustain it and maintain it. Does that make sense? And so if you can gain a few more tools that can keep you in a place that allows you to feel that much more incredible and that much more amazing, that, well, then amen. And so that to me is like what keeps me fired up and continues to keep me fired up, because I learn new things every day. And I've been doing this for 15 years as a doctor, as a student, even longer, because I was totally the shady student that was like treating people in the bathrooms and stuff when I shouldn't have been. So that biochemical component, it's really important. Air purifiers, clean water, look at what deodorant you're using. Is it an antiperspirant? Is it filled with aluminum? Does it have all kinds of things that, can create toxicity in your body and that kind of thing? If so, we don't want that. So it's really important to kind of look at some of the things that we're surrounding ourselves with and that we're putting onto our body. And then the other side of the triad. So we talked structure, we talked biochemical. The last bit of the triad is emotional. And, I'd be remiss to say that emotions and stress don't affect us. Of course it does. And actually, I would go as far as to say that 99% of all of our issues, almost all of our issues, have some component of stress and emotions, because it affects our physiology. Simple example, I feel really, really nervous. I feel like butterflies in my stomach as a result of nervousness, or I get diarrhea as a result of feeling nervous, or I'm so angry, my head's going to explode. And all of a sudden I have this raging headache because I'm so angry. Right. So there's so many different things, but there's so many symptoms that we experience that, again, it just doesn't seem to correlate until it just does. And it doesn't mean that you're, by being stressed, you're causing it. It's not a conscious thing. It's a subconscious reactive aspect. And what I mean by that is that subconsciously or below our awareness, that makes up about 95% of your brain. So your subconscious is reptilian, it's survival, and it's limbic, it's the emotional aspect. So we can get triggered and move and begin reacting and not really even know what it is. But there's a lot of moments when we do know. There's moments like where you hear a song on the radio and instantly you're like, oh my God, that's like my 8th grade dance when I was dancing with Brad or whatever. And then there's moments of you walk into a kitchen and you smell something and it's like, oh my God, I'm like in my and immediately in your mind, in your memory, you're in like grandma's kitchen and because the smell triggered the memory. That's the limbic brain at work. The reptilian brain is survival. So if a reptile, like a crocodile, grabbed onto your arm, you could not reason with the crocodile and be like, yo, Croc, let go, that hurts. The crocodile, in that survival mentality, in that reptilian aspect of the brain, your arm will either be pulled off or the crocodile has to die. It's like that extreme. And we as human beings have that. It's why sometimes we're like, totally panicked, and there might not seem to be a rhyme or reason, but you're in a panic attack, you're having so much anxiety, and someone's like, just calm down, you don't need to be. And you're like, it's not like you're like choosing to be like that. We're never going to be like, oh, gee, yeah, I think I'd like to have a panic attack right now. It's never about a conscious choice. It's that subconscious reactive pattern that tends to take over. And we just don't know. We don't know until we know it. Now, the conscious part of the brain, the neocortex, has logic. Subconscious, no logic. You can't reason with the reptile, right? You can't reason with the emotional triggers. The logical part of our brain has a timeline. It wants to make sense of everything. It has all these goals. I really want to have a loving, amazing relationship. I really want to reduce my weight by 20 pounds, but I keep going into the cabinet in the pantry and eating all the cookies, or I keep attracting like an abusive alcoholic guy. Well, the young woman who had a father who was alcoholic and abusive has survived that. So even though consciously we know that's not a healthy thing to be around, she survived it once before. So that's the attractor field, because we go to what we've survived and we can't help it. So we then tend to attract that which we know we can survive. It's not a conscious choice until it is. So that's the beauty of some of the work that we do. That is what neuroemotional technique does and what the Lifeline technique can support. It's bridging the gap between what it is that we consciously desire and where we keep ending up, right? So that subconscious part of our brain, it taps into that and helps to bridge the gap by finding out where those emotional memories have gotten stuck. And it breaks that broken record pattern so that you can align with what it is that you really desire. Does that make sense? Okay. So that's the whole emotional aspect of it. And it's a huge thing because so much of what we experience would never be a conscious choice. I like to call it gifts in strange wrapping paper because that's kind of what it is. Because without these symptoms and without the smoke signal, we wouldn't know there's a fire. So it helps us to get to the root cause of whatever it is that's going on. And whichever way that we enter the body, we still want to balance the whole of the triad. And that's what allows holistic medicine, if you will. Really looking at, in applied kinesiology, we're looking at your whole meridian system, which is Chinese medicine works on like the energetic meridian system. So we're looking at that as applied kinesiologists as well. But we're also looking at, like, for example, if you had like T8, your thoracic spine and the eighth, number 8 down on the mid back, that sort of bra line actually. So that spot is constantly feeling out. It constantly is sore. And I adjust you and you're like, gee, it's sore again. And the next week I adjust you right there and it's sore again. Do you think it's a structural problem if it keeps coming back? Probably not. Okay. So for me as an applied kinesiologist, I'm going, T8 is liver. Liver in Chinese medicine deals with the emotions of anger, resentment, frustration, depression. Okay. Liver, gallbladder. And liver is also associated with the muscle, the pec major sternal. So for me, like when someone complains of an elbow, I'm not just going to go to adjust the elbow. I'm actually like wondering about the stomach meridian, the heart meridian, the stomach and heart as organs, the emotions that are associated with those. What can't the person's stomach? Is it really an elbow thing? Because, you know, when someone's like, yeah, I've been doing this my whole life, but now all of a sudden, whenever I golf or whenever I play tennis or whenever I lift weights or do push-ups, now my elbow hurts. Well, why now? Like what's happening now that triggered it? Yes, there's that space where it's like over time, there's overuse and it can create physical injury. But a lot of times it's not as simple as that. There's more to it than that. And that is what allows us to really tap in. We muscle test everything and we look to see what's working, what isn't working. Okay. So, and then really finding the root cause so we can help you balance. Once we know, there's so much, there's so much more that we don't know that we didn't know. And once we know it, we can do something about it, but we didn't know what we didn't know. Okay. So I'm really all for creating greater attention, creating that education, but then also really tapping in deeply to understand where did your body go awry and why and what, and can we bridge the gap then and get you into a greater state of balance? Absolutely. Then at that point, how do you support your body specifically with food, specifically with, you know, nutritional supplements and things that can support the detoxification and the rebuilding of the body. But I have to be clear, you don't just go in and detoxify your body. If you're not in a healthy enough state to detoxify, it can actually feel terrible and make you feel very sick. So a lot of people want to just jump in and doctor themselves and start detoxing and doing these like crazy, you know, cleanses and detoxes. And it can actually, you know, cause more harm than good. If your liver's not functioning well and it can't detoxify well and it's already overburdened, it's like trying to clean something that's a drought. Okay. If you don't have water and stuff to flush things through, how do you detoxify like the desert? You don't. You've got to get everything nourished. You've got to get everything functioning first. Then you can start to detoxify. Then it can happen healthfully. And that's important to discern and differentiate those. Does that make sense? Okay. So, okay. Any questions up until now? Any questions, anyone? Okay. All right. So I don't see any questions coming in. So I'm just going to talk for a few more minutes. Once I stop the recording and stop the live, then those of you in the Zoom, I'll open it up for a private Q&A. So that if you have any specific questions just for you, then I'll be here to do that with you. Okay. All right. So I want to just talk briefly about some supplements that can support and like what the hype is about some of the supplements that people have been talking about a lot. Glutathione and N-acetylcysteine are two of them. I don't know if you've heard of those. But glutathione is a major antioxidant. We do have the ability to create it ourselves. Most of us don't. We don't do an efficient, good job of making it ourselves anymore. Or it could be because there's specific precursors that aren't creating it, and it could just be because our health just hasn't been great for a long time. But it is a protector of, you know, poisons, free radical damage. Glutathione lowers stress. It chelates heavy metals out of your system. It decreases oxidative stress. I mean, it's phenomenal as an anti-inflammatory. The things that increase it are alpha lipoic acid, vitamin D, SAMe. We have a supplement in our space called Inspiracell that actually helps as a precursor to glutathione based on some of the ingredients that are in there as well. And it's also wonderful for circulation. So glutathione is huge because of its antioxidant potential and its anti-inflammatory potential in terms of how it supports our body. N-acetylcysteine stops liver damage, and it also prevents excessive mucus and fluid and inflammation in the lungs, which is why everybody's talking about it, especially with the Delta variant, the Alpha and Delta variant of COVID. because there's a lot of fluid and a lot of mucus buildup and excess that happens in the lungs, right? So N-acetylcysteine has been like a huge thing. We do IV nutrition at our office for a lot of folks to support their immune system. It's something called Regeneron, and it includes glutathione, N-acetylcysteine, elderberry extract, which is phenomenal. Actually, that's a great immune booster. And early on, I heard, and I'm not 100% sure about this, so don't quote me on it, but that the elderberry could actually kind of take off the spikes from COVID, like, you know, the picture, we've all seen the picture. It can kind of smooth that out so it doesn't have anything to latch onto in our body. So I've heard that that's what elderberry does. Again, I'm not 100% sure. I just know that it can be helpful. I don't believe that everything is the same in terms of helpfulness to every single person. I don't think we're all the same. We're all created so differently. So I'm really big on giving very specific nutritional protocols. And I do offer that to my patients and folks that call in. I've supported a lot of people to just get really specific for what their body needs, just nutritionally. And I think that can be extremely powerful to know what your own body needs. Because like where somebody might need elderberry extract, for example, me during COVID, my husband tested for echinacea extract. He did not test for elderberry. We both tested for zinc. We both tested, I think, for quercetin. His body wanted nattokinase. Nattokinase is a blood thinner naturally. My body wasn't attacked in the same way his was. I had a cough, he didn't. He had more like, I think, heart stuff and blood stuff. So we wanted to be very careful in that way, aspirin included. Where like for me, it was more like lymphatics and my lungs, it was like more sluggishness. So it just shows up differently in different bodies. Every body's different. So how can you treat each body the same? That's the brilliance of applied kinesiology, because we muscle test and specify. There's no cookie cutter approach. We specify to what each individual needs are specifically. And that's same with the treatment. So each time you come in for treatment, it looks different. And you know, you just generally won't get the same treatment twice. That's just the body's ever changing. And so we're always going to meet you where you are based on your goals and based on where your body guides us to, which is really special. And I think pretty amazing. Vitamin D is huge. I also love things like coated silver. You know, silver is great, but quality matters. Coated silver that I have, it's quite expensive. I have it in my office, but it's 20,000 parts per million per drop. Let me repeat that. 20,000 parts per million per drop. It's like mind boggling. So for the longest time, I had something called Argentin 23. It's an oral and a nasal spray. An oral, you can take it orally or nasally. And 23 meant 23 parts per million, which was like unbelievably amazing because that means it's so fine. And it actually, I used to have chronic sinus infections. So I developed allergies once I went to college, and I was on allergy medicine year round for 8 years. And all that happened was that my allergy symptoms got worse and worse and worse. They did not get better. My body started relying on them. Without the medication, my body forgot how to fight. So that is actually, I learned a whole lot going through that as well, and what it takes to sort of rebuild the system, which is an amazing thing. And I did. So I now do not experience allergies, but how I will notice when I'm having some sensitivities to, you know, pollens or dust or whatever, it shows up in my sinuses. So what prevents the sinus infection for me is this Argentin 23 nasal spray. It's the bomb. Like, I swear by it. And when COVID first started, I learned about coated silver from David Avocado Wolf, if those of you are familiar with him. And it basically kills everything, just one drop of it, because it's micellized. It's crazy strong. So I was using that initially a lot as a preventative. But again, you know, if I were to give you the example of two guys are skiing down a hill. Okay. They decide to go skiing on a mountain, and, you know, one guy is like really rocking it, and he's going crazy. And then he falls and he's like, oh man, that sucked. I just fell. That's he got up, he wiped himself off, and he continued skiing the rest of the day. The other guy, same age, seemingly in the same shape, goes and he's doing the same thing, and he goes, and then he falls also. Only he falls and he breaks a bunch of bones. He's totally bruised all over. He's a disaster, and he's got to be helicoptered out. So what's the difference of the two? The difference of the two guys was the shape that they were in prior to doing the skiing. So it isn't about what happens to us, it's about how we're able to respond. And if we don't have the capacity to respond to the trauma or to the insult from the alcohol or the food or the caffeine, then we don't do good. Now, that includes like getting good quality sleep, you know, it includes all the things. Well, you know, for me, it was like the perfect storm. Totally exhausted, moved my whole office, didn't take a break, nonstop worked, traveled twice. You know, it's like my system was slowly but surely breaking down. So as much as I was taking all of these great nutritional supplements, at a certain point, if you're not drinking good quality water, getting enough sleep, if you're not handling the emotional stress that's happening, the system breaks down and you are a perfect host for pathology. It doesn't mean that you're bad and wrong and you should be shamed and blamed. It just is the nature of the beast. It's life. We're human beings. Things happen, shit happens, and it is what it is. So all we can do is our best. And when that doesn't feel like it's enough because we maybe just don't have enough information, that's when you come to a place like Be Optimal so that you can be supported and educated and taken up yet another level. So that if you're having trouble sleeping, we can help you to get sleep, because sleep is so important. That's when healing actually happens, is when we sleep. So if we're not sleeping with good quality, that's a problem, right? We want to make sure that we're doing that. So that's why I say, like, the nutritional supplements are amazing and it's great to know about those things, but all the other components, that's what makes holistic medicine holistic. And that's why I believe it's necessary for the dynamic beings that we humans are, because we just have so much going on. It's not as simple as 1 + 1 = 2. Here, if you just eat this apple, then an apple a day, then the doctor goes away. Like, it is just isn't that simple. And if it were, but tell me about it, because I would sure like to know. But in my experience, everybody's different at different times. And, you know, sometimes we're just rocking and rolling and we're flowing and everything feels amazing. And other times we just aren't. We're just not happy, or we're just not energized, or we just don't feel awesome. And that's okay. But there are tools and strategies and support that can get you back to a place that feels amazing. There's always hope, because change is the essence of life. That's just it. And that's a cool thing to know. So vitamin D3 is amazing. You must be taking vitamin D3, especially if you live in the Midwest. It's a necessity. Vitamin C is an antioxidant. And zinc is huge. So zinc actually can kind of kill viruses once it's in the cell. So that's what quercetin does. Quercetin pushes the zinc into the cell. So we sell something called quercinase. It has bromelain in it, so it acts enzymatically as well, which is awesome. But yeah, so that's kind of the cool thing about, you know, the way zinc and quercetin works, and why you've probably heard a lot about those, and they're kind of buzzy words and stuff. So those are kind of really fantastic too, in terms of boosting the immune system and getting things in the right place. So for example, preventatively, I was probably taking 15 milligrams, maybe 30 milligrams here and there. When I had COVID, I was taking 120 milligrams of zinc, just to give you an idea. Like, it's very important to understand what your body needs, what it has the capacity to integrate, and how it can utilize things at different times. So different times call for different amounts. And that's where the specificity, once again, of muscle testing can help us get really specific with what your body needs and at what time it's needed. Hormonally, thyroid wise, endocrine system wise, you know, liver, kidneys, brain health, pituitary gland support, you know, all of the different supports that can, you know, help your body to a greater state of health and vibrancy. So that's what we do at Be Optimal. It's so awesome. I love what we do. And if you have, you know, further inquiries or questions, like I said, I'm going to stop the talk here in a minute on Instagram and Facebook. And then, but if you have further inquiries, reach out to us, check out our website, www.beoptimal.com, beoptimal.com. We're in Skokie, Illinois. We do treat long distance. We do telehealth. We support people all over the world with emotional stress and energetic work as well. So feel free, tell your friends and family. We are out to support people, as many people as we possibly can, to a greater state of health and wellness, and to a higher state of consciousness. It's my passion, and I'm excited to house and create a platform for the brilliant, genius practitioners that have blessed the Be Optimal space so that they can continue to pay it forward the way that I'm passionate to do so as well. So thank you everybody so much for being here and being present tonight. Those of you on Zoom, I will hang out for a few extra minutes. So if you have questions, hang out. I'm just going to go ahead and stop the recording.